Hi my beauties. Okay, today we're going to be talking about stimulant fillers. And stimulant fillers are basically non-hyaluronic acid based fillers that are used to enhance your skin's own ability to generate collagen, elastin, and hyaluronic acid to restore volume. So it's typically used in the mid-face, where we start to get some volume loss, or even people who are really fit and they cut down on their weight or become really lean and lose fat in other areas of the body. Sometimes it can age us and make us look old or sickly in the face because we get kind of gaunt and sunken in the cheeks. It also happens with age. As we get older, we lose fat, we have fat atrophy in our face, and we lose, the dermal thickness and a lot of the underlying structural support. Even in the bone, we get bone resorption as we get older that can kind of make this face kind of sink and feel like caved in and hollowing in over time. So these stimulant fillers are really great for restoring volume with a very natural look, because you're basically inducing your body's own regenerative processes to restore that volume. And the two main stimulant fillers that we use in dermatology are Radiesse, which is calcium hydroxyapatite, and Sculptra, which is polylactic acid. And both are used to restore that volume. So these fillers can also be used in other areas off the face for non-facial aesthetic reasons. Radiesse is a great stimulant filler to help with crepey, wrinkly, textured skin on the neck, on the chest where we get chest sleep creases, on the inner arms sometimes where we can get that kind of crepey look in the inner arms as we get older, and on the abdomen sometimes after having babies and being older with more mature skin, you can get crepiness on the abdomen as well. The legs, inner thighs, I inject patients on all body surface areas almost where there's a loss of collagen or where you want to smooth and tighten that skin. And then Sculptra is actually used a lot for restoring volume in other areas too. So mainly buttocks or gluteal fullness, and adding some booty volume is really great. Sometimes combining it with M-Sculpt, for example, which uses intense focus electromagnetic energy to induce muscular hypertrophy to kind of grow volume in the booty area, where some people may need a little bit of help. Adding something like Sculptra injectables to stimulate your body's ability to grow volume naturally from within also can help augment those results. So although I'm going to be mainly talking about the stimulant fillers for the mid-face area, these fillers are also used in other areas of the body for tightening skin and adding volume. So starting with Sculptra, as I mentioned before, is polylactic acid, and it stimulates the fibroblasts, which are the cells in the skin that make collagen, to do that, to make more collagen, to add volume. It also adds hyaluronic acid and just gives the cheeks a nice firm taut, contour, without kind of the wrinkled textured kind of look that we get in the mid-face as we age. It also is great for helping with those little parentheses lines, as you smile. Hopefully I don't have them, but when you smile, you get those little parentheses lines as we lose volume over time. It helps correct that really beautifully with really natural results. And so the way we inject it is it's reconstituted, and it's in a series of syringes. One vial will give several syringes, and as your injector injects it and distributes it over the treatment area, he or she will instruct you to do the 5-5-5 protocol. And what that is you massage it for 5 minutes, 5 times a day for 5 days, and that just ensures that it's an even distribution of the product, and that there's no nodules that can form, because that could be a complication of Sculptra when it's either reconstituted incorrectly or injected incorrectly. But usually the results are beautiful. They last for about 2 years, and anywhere from 1 to 3 treatments are needed to get to your endpoint goal. So regardless of your age, I believe from my experience in treating patients with Sculptra is that usually we'll do 1 treatment, see how you respond, and you may need another or a third one depending on how you're responding and what your desired outcome is. They used to say 1 vial per decade, so if you were in your 40s, you would need 4 vials, which would be 1 treatment, every month for 4 months, or if you're in your 60s, you'd need 6 vials. But honestly, just looking at the data and just from experience of doing this for 15 years, usually people respond anywhere from 1 to 3 treatments and get that big jump in improvement anywhere between 1 to 3 treatments, and that's usually all that's needed. And again, you enjoy the benefits and the results for about 2 years. Then the second stimulant filler is Radiesse, and as I mentioned before, that's calcium hydroxyapatite. And basically what that does is it also stimulates your fibroblasts to make more collagen in the skin to help tighten, to improve texture and smooth fine lines and wrinkles. So Radiesse can either be injected just straight from the product, or it could be reconstituted and hyperdilute. So if you see injectors post, on social media, hyperdilute Radiesse, it's usually when you're covering like a broader area and you're not doing it so much for volume restoration, you're doing it more for texture improvement or smoothing out wrinkled, laxed skin. So for instance, if you're using Radiesse for the mid-face, which I usually use Sculptra for my stimulant filler in the mid-face, but some providers choose Radiesse in this area, they would use it straight out of the product, how it's manufactured and delivered. If you're injecting it for more collagen stimulation to improve texture, for example, if somebody has neck laxity and you want to feather it under that delicate skin to kind of like smooth and tighten and even the skin over, that a larger area, it's usually reconstituted to make it a hyperdilute solution. So that's what we mean when we talk about hyperdilute or straight Radiesse. And Radiesse is used in all areas of the body. It also can be used for buttock augmentation for people who don't want a BBL, but they want a little bit more booty volume, especially petite girls like me or people who weren't born with a lot back there and have to work. You want to do your M-sculpt, you want to use your trainer, you want to lift, you want to do your squats, eat healthy, eat clean, but then also a little bit of Radiesse and Sculptra back there will help augment that as well. Results last about 2 years, so Radiesse is used for that. It's used for mid-face volume loss, it's used for tech neck creases, it's used for laxity. It does really, really well with laxity of the neck, chest creases, sleep creases, and also in the hands. So where you start to get skeletonized hands as your muscles become atrophic. As we get older, we lose the dermis and the thickness of our skin in our hands, which can show the tendons and the veins through the hands, and they become skeletonized, which can age us. So Radiesse is really great for it in the hands as well. And just as a provider, different fillers perform better in different areas. Sculptra could also be used in the hands, but I like Radiesse results better in the hands. Radiesse and Sculptra can be used for mid-face. I like Sculptra more for mid-face. So it just depends on your provider and his or her experiences and what they're comfortable with, but certain fillers perform better in certain areas than others, and depending on the goal that you're trying to achieve, it's important to select the appropriate filler for the appropriate patient. But as far as stimulant fillers, it's usually Radiesse and Sculptra, which are the two most common stimulant fillers. Now there's a lot coming down the pipeline in the future, and I'm excited to keep you guys on this journey with me because I'm on top of the technology. We keep you years ahead of everybody else, but there's a lot of combination, even stimulant and HA fillers that are going to be coming out soon, which are going to have amazing results. And so I think those are currently undergoing clinical trials, but I'll keep you in the loop as new devices and new technology and new dermal fillers, new skincare products are launched and available. I'll definitely keep you in the know. But I wanted to do this video on stimulant fillers because a lot of you guys have asked me about that, just kind of here and there throughout comments and requests, and I wanted to do a stimulant filler video that I could reference when people in my office ask me about stimulant fillers as well. But knowing that there's newer stimulant fillers coming in our near future, undergoing clinical trials, is a really promising and exciting time to be in aesthetics and dermatology, and I'll always keep you in the know with the most recent discoveries and advances in aesthetics and dermatology. I hope you guys find this video useful. Hit the subscribe button, hit the bell, because also on my YouTube channel I always do random spontaneous live Q&As where I'll answer your questions in real time. I'm your personal dermatologist and want to be able to just answer questions that you guys have, not only in dermatology or skincare or aesthetics, but any area of medicine here too. So be sure to subscribe and follow and share this video with anyone who may find it useful.